Okay, so we're going to start with some upper back release, upper back massage. This is going to be a bit of deeper work today. So I'll kind of walk you through how I typically start an upper back treatment. A bit of assessment first is often what I do is I'll just check either side of the ribs and the spine to just see how things are moving. Usually you'll feel on most people that one side of the ribs doesn't have much spring to it. For my client today, it actually feels pretty good. Both sides are moving, but usually one side you'll get a rebound, one side will be pretty stiff, and that's just from life and people's jobs and work and that sort of thing. But I always check that first because if there's one side that's really stiff, you're probably going to work on that side a bit more to see if you can get a bit more rebound and release through those muscles. So yeah, feels pretty good both sides. You can check the tone of upper traps, upper back. You're just assessing and seeing what you might work on a bit more. Even low back, you can come down here and see. Yeah, feels okay. It's pretty even today. So, let's just do some general upper back work with massage. I like to start before any oil or lotion. I like to start with just some fascial work. So you're just kind of bowing the paraspinal muscles, checking the fascial restriction or anything like that. We got a lot of movement today, which is good. Some people won't move at all, so this is really good. But yeah, you're kind of just bowing the paraspinals, the costovertebral joints. You're kind of opening those up. Sometimes you'll get a bit of a crack or pop or release, which is always nice. That's good. You can come to the upper back, rhomboid area. This is just kind of fascial work. Like it's supposed to kind of pull the skin and the fascia and create a bit of a gliding through the layers. Nothing too complex though. You will have to spend a bit more time with people where you check their skin and it doesn't move at all. This is a lot of movement, so that's good. But yeah, we can come to the other side, same thing. Working through mid traps, rhomboids. Moves quite well. Let's go back to the paraspinals in that mid back. Right away, I feel some more tension in kind of upper left shoulder blade. So, that'll lead me to probably work in there a little bit more and see if we can loosen that side up. Whereas the right feels good. Not too bad, but we'll get both sides today. So let's start some massage work. So I'm just going to get a bit of oil. And when you're treating the back, like typically you want to get the ulnar side of your hands with oil as well, because when you want to spread the oil, it's better to start with the ulnar side and kind of work your way down and into your palms there. It's just easier to kind of spread the oil throughout the back. So again, I'll just go through some of that. Another nice thing to do is instruct your patient to take a nice deep breath in before you start. Good, and on the exhale, you just lean in and push. And you'll usually get some cracks in the back too, which is always a nice release. Another breath. All right, so like we said, that left shoulder needed a bit more work, so I'm just going to jump into that. And we're just starting general, just warming things up. So, as you know, when you're doing a lot of massage, your hands get really fatigued quickly. When you're seeing like 7-8 patients a day, it's a lot. So I'll spread some oil with my hands and I'll honestly quickly jump to elbows and forearms. So especially for this upper back region, you can utilize your forearm to work into rhomboids, mid traps, upper traps a bit too, and lower traps. So you're getting all of upper trapezius, mid, and low. And I'm just sinking in and working my way down. And Toscany is one of my long-term patients. I've seen him for years, so I know his tolerance and his pain kind of threshold and what he likes, and he likes the deeper work, so I'm not afraid to really lean in and just kind of squat and use my body weight here. All the way down to the iliac crest, and you can kind of go laterally at the end. But yeah, I'm leaning decent amount of pressure here. Okay, I'm going to transition to upper trap. So this is going to be some more deep work with upper traps. Warm it up a little bit, but then honestly, I just hook in with my fingers to the like anterior aspect of it, and I just lean back. I lean away and just go for it. This is how I like to release it. There's a lot of different ways that you can do it though. Hooking in and just leaning away. Kind of bowing the muscle, separating the muscle, and it feels awesome. Everyone's got tight upper traps. It's just the way it is. Yeah, check in with your patient. We doing okay?
Yeah.
Yeah. Nice, and then I'll come up to posterior delt too, do a bit of workout here. Nice. Okay, so I'm going to get a bit more specific. We're going to check out levator scapula, okay? So this muscle is, it's tight on everybody, pretty much, especially if you have a desk job and your shoulders are forward. If you're a massage therapist, your shoulders are forward, you're leaning over all day. So you often get tension right at the origin, at the superior angle of the scapula, okay? And this muscle, the origin is actually a lot more surface area than you'd imagine. I've seen it in a cadaver. So it's not just the superior angle of the scap, it actually goes to the medial border as well. So it's this whole kind of area. If this is the scapula, you can kind of see, work your way up. You can feel it's just a lumpy, strong muscle. So I'm going to work on that. Typically what I'll do is just use my thumb to work in, and I'm using my other finger to support it. And I'm just working superiorly. And you can feel all the little fibers rolling under my fingers. This is one way to work on it. You are working through the traps, through the upper traps. So it's not just one muscle, you're getting layers here, but you do have to sink in. If your thumb gets tired, you can do elbows, or what I'll do is switch to fingertips. I just find this easier on my body. I'll find that superior angle of the scap here and just sink in. Good. You're just doing like an ischemic compression here to the muscle, and then I'll work down to the medial border as well, and then come back up, compress in, have them breathe. If you want to do more of an active release too, you can, same kind of positioning here, you put your fingers, dig into levator scapula, and then have them slightly elevate the shoulder, so a bit of a shoulder shrug. Come up, yep, you'll feel it activate, hold, and then release. Get your patient to release, good. And this just creates a bit more movement in the area that you're working, which I find will speed things up. It'll help it release a bit. Elevate again there, little shrug, good, hold. 3, 2, and release. You can also mobilize the Scapulothoracic Joint, which is where the scapula sits on top of the thoracic ribs. How I like to do this, you know, so with some people you can't get under there right away, so you have to do a lot of work here to loosen that up. Another way to go about that too is to bring the hand on the low back, support the wrist, tell them to relax the shoulder and the arm, and then you can loosen it up back this way with your forearm. And then you'll get a lot of movement out of that scapulothoracic joint. And once it starts moving, you can kind of pull out laterally. And this is just to mobilize it, get it moving. You're kind of stretching the traps and the rhomboids here. And it's moving really well, so I'm not too worried about that. But that's one technique to get under there a little easier. And then once it's loose, this is what I do. There's a lot of approaches, but I'll just hook under the medial border and just pull laterally. Just use my body weight. I'll kind of lock my shoulders and I'm just pulling out. It's awesome. Always feels really good after. Levator Scapulae with the elbow here. You can sink in this way. There's lots of stuff you can do. It's a big lump there. That's lower traps, the border of lower traps. So a lot of people think, is that a knot or am I really tight? But it's honestly just the border from one muscle to the next. So it's a little shocking, but it's not a bad thing. But for the sake of this video, we're going to get into a bit of scraping here, because even as I've worked, you can see a lot of redness where the blood is kind of coming to the surface of the skin. So it does move really well, but let's do a bit of scraping and see if we can kind of get in there a little more and release a bit more tension. So we're going to do some IASTM now, some scraping to Toscany's rhomboid and mid to upper trap region, and see if we can get a bit better of a release in there. So just going to add a bit of lotion. Good. And then use the tool. Now we're going to scrape. We're going to scrape with the muscle fibers and against them. We're going to do a bit of both. Already you can see that there's some capillary kind of response or release in that little area there. So we're just gonna a bit more here. Okay, now we're gonna go more cross fiber on rhomboids here. Something I see often is lower trap always has restriction and tension in it. So you kind of palpate the lower trap border, roll over it there. So somewhere in here, you'll often see restriction or people complaining of like deep rib kind of pain. So often when I'm scraping, that spot will always show up with that capillary release, just basically because it has a lot of restriction and adhesions and just wear and tear in that area. But not bad on Toscany today. It's more kind of mid-traps rhomboids area. I'm going to get Levator Scapulae a little more with that superior angle and medial border. But then I'll just palpate and feel how it feels. It feels really consistent, really smooth. Awesome, that's what we want to see. So then I'll just come back and just finish off with that area with some general strokes coming up to the back of the neck. And again, using that ulnar side first, really pressing in to do some deep work of the back. You can use your knuckles too, lean. And another deep breath here. Good, all the way out. Awesome. There we go.